Okay, all right. Good evening, everyone. Thank you for joining us tonight for our ACES virtual health career chat. We have our student host, Roida and Gibby, tonight that will be interviewing our health professional, clinical pharmacist, Jocelyn McGrath. She has volunteered to join us tonight and be interviewed by Roida and Gibby. So I will go ahead and I will let them take over from here so we can go ahead and get started.
All right. Hello, everyone. I just want to start by saying thank you for attending. We appreciate it, and we're excited to see you here, and we're excited to have Jocelyn here. As Taylor said, she's a clinical pharmacist, correct?
Yes, that's correct.
Okay, I thought so. Okay, so my first question is, will you please introduce yourself and what you do to our audience?
Yeah, hello, everyone. My name is Jocelyn McGrath, and like everyone had just previously mentioned, I'm a clinical pharmacist at Mosaic. Specifically, I'm the emergency department pharmacist. So I work primarily in the emergency department. And then if I'm not in the emergency department, I'm up in central pharmacy, but I am a clinical pharmacist. That's a little bit about what I do. I do have twin infants that are almost 16 months old. So they're a handful.
All right. Well, thank you. Sounds like sounds like a fun time. That's interesting. I didn't know that they had pharmacists that work in the ER, so that's kind of a little fun fact for me because I wasn't previously aware of that. So my next question is, what was your inspiration for pursuing this career? Kind of how did you get on the path, and what led you into it? What made you decide to stay? Things like that.
Yeah, absolutely. I was inspired to go into pharmacy. Actually, it was my calculus professor who had suggested that potentially pharmacy could be a good career choice for me because I was really gifted in, obviously math. And then also I love my sciences like chemistry, everything to that nature. And so he told me, maybe you should go do some job shadowing. And he thought maybe a pharmacist would be a good position for me because I'm very type A and like everything in line and in order, very orderly person. And so he just kind of thought, you should look into it. And so I went ahead and started job shadowing. Well, I was always a volunteer at the hospital. I always knew that with my career, I wanted to help people. I just wasn't sure which direction it was going to go. But I started job shadowing and I was a volunteer at Mosaic. And I actually job shadowed one of the pharmacists that I currently work with now. Her name is Stephanie Lager, and she works in the ICU. And so that was my first time ever seeing a pharmacist outside of an actual pharmacy. And so I job shadowed her, really got inspired, thought I wanted to do critical care, but wasn't 100% sure. And then after I did my residency, when you do your residency after you graduate from pharmacy school in order to be a clinical pharmacist, I really, really enjoyed my time in the emergency department. I knew that's kind of where I wanted to specialize. And so it just kind of went in that direction, after residency. And so, I know not a lot of people know that there are pharmacists in a lot of different spots than just at the pharmacy itself, which those ladies and gentlemen have definitely a super important role in healthcare as well. It's just totally different from working in the hospital setting. It's like apples to oranges. So there's you can specialize in all different kind of areas. You can be, mainly cardiology versus oncology or critical care. They did come up with a board certification for emergency medicine finally. So I'm going to be trying to take my board certification coming up here, hopefully within the next year once things calm down, with the twins. But it's just another certification that will help you specialize in like a particular area. But there's residencies that you can do for just 1 year. Those are called PGY1s, postgraduate year one residencies, and it kind of helps you become a more well-rounded clinical pharmacist. And then there's also have the option of applying for PGY2s, so a second year of residency in which you can specialize in different areas, like I mentioned before, like cardiology, geriatrics. I believe they have a specialty pharmacy credentialing, and then also critical care, definitely psych and oncology. Those are some other areas that you can really specialize in. But yeah, it was actually my calculus professor who inspired me, and Stephanie Lager, our current our current ICU pharmacist who I get to work with now. So it's pretty cool. It kind of came full circle.
Well, that's great. That sounds quite awesome. I'm glad that you were able to kind of have that inspiration to go into it. And that's really awesome of your calculus teacher. Also, I'm sorry if you can hear like background noise. My dogs are starting to bark. I don't know what at, but if you hear background noise, that's what it probably is. But anyway, that is quite exciting, and good luck with your board certification. Am I correct in saying that? Cool.
Yeah,
well,
so
good luck with that.
well, yeah, I'm just now starting to study for it. It's not in the book like that, but it's definitely within the next couple of years on my career that I
Yeah.
But it is pretty
Yeah,
cool.
that's awesome.
I volunteered at Mosaic before it was actually called Mosaic. It was actually Heartland Health when I was volunteering there. And the funny thing about the whole thing is that I actually did used to volunteer in the emergency department as a person who would just check people in and put wristbands on people. So it's really kind of fun now, just thinking about how how that had like such a big impact in my life. Just volunteering at the hospital really kind of got the whole thing started.
That is great. Can you excuse me for just a minute? I got to go take care of something with my siblings. Roada, will you take over for the next couple of minutes before I get back? Or while I do this? Thank you.
Of course, no problem. Yeah, that's all right. I'm sure we all can relate, anybody who has siblings. So
Yeah.
no worries about that. But thank you so much for sharing that. Personally, I thought it was very interesting that you get to work with the person that you shadowed. That must be like a real moment.
Yeah, it's very cool. And I learned so much from her still, to this day, because Stephanie is so good at what she does. And, pharmacists, I feel like we learn something new every single day. If you're in healthcare, no way to memorize everything, so it's great to kind of learn from each other and be a continual learner.
Yeah. And also with the college tips too, because healthcare, you need college. Create those relationships with professors because they'll actually open you up to opportunities, right?
Yes, absolutely.
Yeah. Thank you so much for sharing that. So I'll move on to the next question now, which is, can you share what your daily responsibilities look like as a pharmacist?
Yeah, so my daily responsibilities is a little bit different on whichever where you work as a pharmacist. So I can start by my position. So being in the ER, my role is a little bit different than the other pharmacists. I do a lot of bedside preparation of medications. So I work really closely with the physicians and the nurses in order to prepare medications, especially like for really critical patients. So I attend all codes, intubations, anything that has a lot of complicated medication administration. I'm really there to help the nurses be precise with doses and to help set up drips and that sort of thing. So I do a lot of bedside preparation, where some parts of pharmacy is more order verification, which is great. But I do a lot of like hands-on bedside assistance. I also do what's called culture follow-up. And so that's kind of different too. I actually am contacting patients on a regular basis about their antibiotics and making sure that what was prescribed to them is actually still going, because once we take cultures in the emergency department, those results will actually take 48 to 72 hours to give us a final result. So oftentimes we start patients on medications in order to treat any kind of disease state, but then it may come back resulted that like the organism is resistant, so they need a different antibiotic. So it's my job to coordinate that care, and so I will either be contacting primary care offices to let them know that the patients need new antibiotics, or I'll be talking directly to the ER providers and I'll give verbals to change their antibiotics, that sort of thing. I do Also, like with that, we check blood cultures, urine cultures, wound cultures, so all sorts of things. So, and then in the midst of all of that, I'm also verifying every order that comes across stat from the emergency department, as well as helping out the entire hospital queue. So basically making sure that all of the medications that we're giving to our patients are appropriate dose, strength, and duration. Yeah, so a lot of order verification, preparation of meds, and the culture follow-up is mainly kind of what I do as far as daily responsibilities. But the other thing that we do as pharmacists a lot are drug information questions. So what that means is, a doctor may have a question about something and they need the answer for it, but not necessarily right in the heat of the moment. So drug information and being able to do literature review and review of primary literature is super important as a pharmacist in order to understand what information that we should be basing our medical decisions off of. So drug information, literature reviews. The other thing that we do is we do manage at Mosaic. Our pharmacists are consulted to manage vancomycin, which is an antibiotic. I'm not sure. I've never know what population you guys, what about medications or not, but vancomycin is an antibiotic, and you have to dose it based on patient-specific factors. And so at Mosaic, the pharmacists are actually the ones that are dosing this medication. So we dose Vanco, we dose warfarin, and TPNs, which is nutrition. These are all consults that I manage on a daily basis as well.
Yeah, so it appears like a lot of lab work with the, the culture. Is it culture shock? Is that what you said?
Culture callback, sorry.
Culture callback, my bad. And
Yeah.
so, that's pretty interesting because I didn't expect there to be so many different components that went into pharmacy. It's just interesting to see how you balance every single thing. It's a lot. But definitely a lot to take in. Props to you for managing all of that. So the next question, the next question kind of goes off of the previous question. I just asked you about your daily responsibilities, but with that in mind, do you do every single one of those things every single day, or is it just it depends on the day? So kind of what I'm asking is, what does a typical day look like for you?
Yeah, good question. And yes, I do all of those every single day. The biggest thing, what kind of makes or breaks my day is, I would say, culture follow-up. So sometimes there are more bug drug mismatches that I need to intervene on than other days. So for instance, some days, everything just matches up perfect. You have an E. coli UTI prescribed Keflex, it's sensitive to cefazolin, good to go. I don't need to intervene on it. I just review the profile, make sure the meds are great, and sign off on it. Whereas other times, they have E. coli growing in their blood. That's a bacteremia. They need to come back into the hospital. So that's about at least two or more phone calls for me to get that patient to come back in and get some IV antibiotics. So depends on the day as far as what I do, but all of those aspects, I would say I do at least a little bit of everything of that every single day. Yeah. So it's multitasking is on my list for our soft skills coming up for that question.
Yep, definitely. And, I honestly think the lab work is very cool. And this is just a side question, but for somebody who enjoys working in labs, working with blood, kind of like a phlebotomy type of career, would you advise this career for them, given the lab component of it almost?
It's a good thought, but I would say no. It's very different from lab. So we don't really I'm not in the lab, so I'm not really analyzing the agar plates or anything like that. It's more of I act on the results. So it's a totally different kind of skill set. But yeah, good question. It's just very different. So mine is more taking the baton from the lab. The lab does their work and then I kind of take their baton. So kind of, I would say, really different than lab. Yeah.
Yeah, thanks for sharing that. I just kind of thought about that. So it's pretty interesting. Given the medicine and, kind of getting it to the patients, especially when, there's a lot of important components with medicine because, you don't want them to misuse it. There always has to be an understanding of what to do with it. So yeah, definitely good communication with that. So the next question I'll ask you is, what is the biggest challenge you faced in your career?
I would say the biggest challenge that I've faced so far would be my residency year. So your residency is very, very intense, and they demand a lot out of you and expect a lot out of you in order to pass. And so throughout the residency year, you not only have to work on rotations, rotating through all the different specialties, but you also have to work as a pharmacist, like staff. And I worked every other weekend with only 2 days off the entire year. And then on top of that, you have your case presentations. I had my residency was pretty demanding, so we had to do a disease state presentation that was an hour long every month. And then on top of that, you have a longitudinal project where you work on a research project and you try to get that published by the end of the year. So residency is extremely, extremely demanding. It's actually whenever you're, if anyone's interested in pharmacy school and being a pharmacist and then pursuing clinical pharmacy, residency year is equivalent to 3 years of experience. Like that's how they kind of grade you as far as like entry level, like when they're thinking about like hiring after. So like 1 year of residency is equal to like 3 years of clinical experience. It's pretty intense, but I feel like that year was extremely difficult, but it's so rewarding because the amount that you learn from other people that entire year, and then also pushing yourself kind of to the limit with in order to like manage all your different expectations and tasks. Like you would be surprised at how much you can accomplish when when you're faced with that mountain. But I'd say that so far has been the hardest thing.
Yeah, the fact that you said that 1 year of residency is equal to 3 years of clinical experience just shows how rigorous that is.
Oh,
So definitely respect you for going through that.
there were all-nighters for sure. At one point, and my residency was pretty rigorous. They didn't give me any extra time. Like they don't allow for extra time for data collection for your research project. So like I used to come to work at like 3 a.m. or 4 a.m. and do my data collection then before I would start my rotation, because then you're expected to work up all your patients, present all your patients, and then also do your presentations. So it's pretty rigorous, but it's definitely worth it. The knowledge and experience that you get from doing your residency is something that I never take for granted, and I would recommend to anyone who wanted to do clinical pharmacy for sure.
Yeah, and I'm sure residency is like not, well, I feel like you're not the only one who believes residency is difficult, as I'm sure many different fields find residency very tough due to the long, grueling hours and the workload. But with that, I feel like pharmacy just kind of seems especially difficult given that, like you said, you don't have time to do all these extra things. So I
Yeah.
respect you for going through that. And also just, it must be exciting too. Like you said, it's rewarding. Is it exciting to actually get to do what you're wanting to do instead of like being in a classroom?
Oh yeah, for sure. I think it's at the beginning it was kind of daunting. It's pretty scary because you practice in school on paper, and then all of a sudden boom, you're in the real world. These are real patients. And, every single decision that I make throughout my day, I'm very cognizant that every single thing that I do in regard to my job directly affects another human being. And that's kind of a heavy burden, I would say, about work. And I take that very seriously. And so it is extremely rewarding, knowing how many hours I put in towards my education and being able to use that in order to like help another human. So yeah.
You said that, and I just thought about calculus because you mentioned your calculus professor. It's like getting the math problem and then getting a word problem with it, in which you don't know what to do because it's a real life situation.
Yeah. Uh,
Yeah, but next question I'm about to ask you could relate, but not in your situation, because with this question, with COVID-19 is what it's going to be about. A lot of healthcare professionals found this time especially difficult. So last question I'll ask you before I pass the mic back to Gibby is, how has your career changed in response to COVID-19?
I would say in the beginning of COVID it was actually kind of a scary time, but I don't know, maybe it's the ER in me, but like not for me, not much. It's changed because I'm just used to being around patients that are sick. And so I just kind of treat it the exact same way that I would all other patients. But in the beginning, it was scary when you didn't know what was going on and they were putting up plexiglass, barriers and that sort of thing. As far as it hasn't changed anything for me, I'm still extremely hands-on. It doesn't stop me from going in any of the rooms, helping my sick patients. Like I'm definitely going to be there, to support my team. So, as far as that goes, I don't think it's changed too much. We still need pharmacy through COVID, so that's good. Job security, right? I don't. That's probably like a terrible answer. I don't know. I'm sorry.
That's all right. But just out of curiosity, did your work hours also go up? Because I know a lot of healthcare professionals worked overtime during that period to the point of burnout. So,
Right, absolutely. And actually what happened with us, unfortunately, we had to they had department cuts, so we had an increased burden on the people who were still there, if that makes sense. That has kind of leveled out now, but we still have like extra responsibility because a position was removed to make cuts for the initial loss during COVID. Like I said, though, we are getting FTEs back, and so the work is kind of evening out again. But we definitely I definitely experienced like a heavier workload at work, especially because we were down a couple of pharmacy positions, so we didn't get more help, but we did have a higher patient volume, so there was more meds to verify and less pharmacists to do it, if that makes sense. But that's kind of evening out now. Good question.
yeah, it's kind of crazy how people are still experiencing the effects of COVID even today, especially in healthcare. So, yeah. And again, thank you, because of you guys, people were able to get treatment and COVID was able to surpass. So, thank you. I'll pass the mic to Gibby now. So, on to you.
Thank you. And thank you for covering for me. I appreciate that. I've really enjoyed hearing all your input and everything. And, you talking about computations and everything like math stuff and having to know, things like that. It reminds me of my chemistry class that I took last year. Because my teacher explained to us that, if we were ever going to go into pharmacy, not only would we have to do mathematics in our head, and we'd also have to know like the formulas and everything, but we'd also have to know like specifically how to do it because at least what she told us is that like when you're doing pharmaceuticals and stuff, you can't get the dosage wrong
Right.
because it can be kind of dangerous. So I was kind of thinking back to that, and I think that it's amazing that you are able to help so many people and work with them and work with your team and come up with like ways to help them and give them the things that they need. And so, we really appreciate that. And as Roida said, like working through COVID, it means a lot to the people that don't work in healthcare because we really needed it. So, thank you.
Thanks. Thank you guys.
Yeah. So my next question is more kind of about your career and things that you like about it, what parts are something that you look forward to, like going through every day, things like that. So what part of your career do you like the best?
So I would say as far as ER pharmacy, the part that I like the best is working amongst my team. I love the fact that I work so closely hand to hand with nurses and physicians. I think that is the best part of my job is just the collaboration, the interdepartmental collaboration, and the way that we all pull together to take care of our patients using different specialties. To me, I think it's so special that like people with different professions are able to so closely work amongst each other to get the best outcome. So that's like my absolute favorite part of my job.
Yeah, I get that. That's good. I'm glad that, you have something there that you really enjoy. I also enjoy working in teams that, I like working independently too, but I find it kind of like a sense of self, kind of like a sense of dignity working with other people, because, you have your team and you guys get to know each other and you work with each other all the time. So, it kind of gets to a familial point where you're like, well, I know these people so well and we work really well together. So that's great that you're able to have that. And this next question is kind of the exact opposite of that. What parts of your jobs do you dislike?
Oh, that's a good question. I will say anyone who works in healthcare knows that sometimes it's a little hard as far as work-life balance. So, the pharmacy is a 24/7 gig. There always has to be someone working. So I definitely do my fair share of evening shifts and weekend shifts. So currently right now I'm working every third weekend and then every Tuesday evening. And so sometimes that can be hard on the family life. So I would say that's like the hardest part of my job is those weekend shifts. But it's definitely understandable. People need care 24/7. There's no stop in the pharmacy.
Yeah, I I understand that. Having to have somebody constantly there, it's definitely kind of like I don't want to say like a stick, but kind of like an obstacle in the road, something that they constantly have to work with. And I think it's interesting that you mentioned your work-life balance, because that's actually the next question is, how is your work-life balance? Kind of how does it work out? How do you do it? Like,
Yeah.
what are the challenges that come with it? So there you go.
I would say the challenges with it are that are we do work evenings, we do work weekends, so there are times that we are away from our families. However, at least I'm lucky in pharmacy, our shifts are usually 8 hours. So on a typical night, I'm typically able to come home and at least have dinner and put my kids to bed. Whereas I know some other jobs, like positions, aren't 8 hour shifts, they're like 12-hour shifts. And so sometimes those people don't get to have dinner with their family or come home and tuck their kids into bed every night because they're working 7 to 7. So with pharmacy, typically our shifts are typically 8 to 4:30, unless we're working our evening or weekend. But so typically I'm able to come home and you know do the number one role as mom, but it gets hard sometimes, especially working every third weekend. But the more people that we hire and like the more shifts that we have come back, the better that work-life balance gets. So I just try to maximize the time that I have with my family, and not kind of focus on the work part when I'm at home. So when I'm home, I try to really be at the mindset of being home instead of bringing my work home to me. And that's another good part about pharmacy too, is I feel like we can really, like, once we leave our shift, we can really shut it off and just be at home. There's not really much. I guess right now is not a good example because we're transitioning to Epic, and so I have a lot of extra projects, and like I actually have been working at night at home. But typically when we're not transitioning EMRs, I wouldn't have to do anything extra at home. Like when I log off, I log off. But so that's a good part too of the work-life balance.
Well, that's good. Yeah, it's really nice that you're able to, go home and spend time with your family. I mean, that's really great, that you're able to have a good balance between that. I'm glad to hear that.
Yeah.
And so my next question before I give the mic back to Rowada is, what was your educational journey? Can you share it with us? Kind of like what colleges you went to, the majors that you took, why you chose the college that you did, and the major. Well, you told us kind of why you chose the major that you did, but kind of how was that journey for you? What did it look like? What were some challenges? What were some good parts about it? Just some things like that.
Yeah, definitely. So I'm kind of the exception. I really, so like I said, my calculus professor is the one who told me to go to pharmacy school, and I actually took a lot of dual credit classes in high school. And so I went straight to pharmacy school. So I only had 1 year of undergraduate before I was in the pre-pharm program. So a lot of people will get their bachelor degree and then go back and get their PharmD. But I was lucky enough, and I got like, I didn't get the program straight out of high school, but I did only do 1 year of undergraduate at Mizzou, and my major was pre-pharm, and I got into pharmacy school that fall. Like, so I went to Mizzou for a year, and then I think I applied for pharmacy school like in the fall and got accepted like for that next fall. So I only did pre-pharm straight from high school. So I didn't do anything extra. Just pre-pharm and then PharmD program. And then at Mizzou, I actually applied for their satellite program for pharmacy school. So what that is the main campus is at UMKC, and they have an opportunity to where they actually project all the classes to a campus at Mizzou, and then they also project to a campus at Springfield. And so those Springfield and Mizzou campuses are considered satellite programs because basically you're just watching the lectures on Zoom. You do have the ability to speak and raise your hand during class, and like a camera will come over to you and you can speak into the microphone to ask your questions and to actively participate, but you are on Zoom. So yeah, in like every seat that you have at the UMKC main campus, you're mic'd up. You got a microphone in front of you. So I was kind of a first row kind of gal. I like to jump in on those questions because I hate awkward silences. So I would always answer the questions because I'd always be like, okay, we're gonna move on now. someone just answer it. But yeah, I actually got in. I applied when I was at Mizzou to be on the satellite campus, but when I got accepted at the main campus at UMKC. So I did my got my PharmD at the UMKC campus after 1 year of undergrad.
Well, that's really cool. I think it's really interesting that that you had a class like that where it was all on Zoom, but you still had like a camera with you, and I think that's really great that you're answering questions for that. I also think it's really cool that you got into pharm right out of high school. I feel like that's not to something that a lot of people would jump right into, and I think it's really cool that you did. Yeah, that's quite interesting. I think that's very good. Good job. All right. So I'm going to turn it over to Rowida now so she can ask you the next couple of questions.
I think your camera might be frozen. Okay, now you're unfrozen.
Oh, sorry, I was having like brief network issues, kind of put into panic mode for a bit. Anyways, so with that, I heard you said you took a lot of dual credit classes. So was that able to get you to shave 3 years? Hello?
Oh, I think you cut out. I'm so sorry.
Am I here? Oh, sorry. Okay. So with that, you said you took a lot of dual credit classes. So with that, were you able to shave off 3 whole years off of your undergrad?
Oh, it wasn't 3 whole years. I think it was a year though. I think it was at least a year because I took calculus and I took chemistry and English, and it wasn't 3 whole years. So with the PharmD, I guess I should explain that a little more. Yeah, that's a good question. So like the way the PharmD program works, when I was in school, you only needed 1 year of undergrad plus 5 years of professional school. So now I actually think that the programs are different, and don't quote me because I could be wrong, but I'm pretty sure they only require 2 years undergrad and 4 years professional program now is the way that it's split up. I believe.
So with that undergrad,
go ahead.
Yeah, okay. So with that undergrad, is there like a specific degree you need? Because I feel like if you go pursue something else, you kind of need 4 years to complete those. But with pre-pharm or like a pre-pharmacy bachelor's degree, is that kind of different?
It's different. I think your major is just quote unquote pre-pharm is like what you do. And then you so like after your 2 years of undergrad, if you make it to into pharma, like if you're accepted into the program, you just end with a doctorate. Like you don't get a bachelor's. You most certainly can. There's actually a lot of people because with the direction of pre-pharm, you're actually taking lots of chemistry classes. So like I was really close to having like a minor or, and a major in chemistry, that sort of thing. So you can certainly go about it in that direction too and finish a bachelor if you wanted to. You might be a couple classes, but pharmacy school is pretty rigorous. Like once you get into the program, like I don't think I ever took less than like 20 hours at a time, so like there really isn't a lot of extra time to take other classes.
Mm-hmm. Yeah, that's pretty interesting because I wasn't sure how long it took to become a pharmacist, and also with competitiveness. Would you compare it to like the medical field now, like medicine or even veterinary school or dental school?
Yeah, I would say so for sure. I don't know if much has changed since I was there because oh my gosh, now it's been like I don't even know. It's like I feel so old now, but I think it's changed a little bit. But we used to take, an exam before even applying to pharmacy school, and kind of based on what your grades are in that exam, they would kind of propel you to get accepted into pharmacy school. I'm not sure if they're still requiring that exam or not anymore. Right now, I would say that pharmacy school numbers notably are down. And the only reason that I know that is because I'm on like the committee for deciding, our residents here at Mosaic. We interview all the PG or the candidates that want to come to our PGY1 program. And I've noticed a significant drop off in the number of candidates that are even applying. And when you look at the schools right now, like my graduating class, I think had like 120, and right now it's way less than that. It's something like 80 or something. So it's a pretty significant right now. There's a lot less enrollment in pharmacy schools, I will say, that I've noticed.
That's pretty interesting. And for the test, is it like, I know for medicine there's MCAT, for dental there's the DAT. What is it for pharmacy?
It's PCAT. So replace the
Oh.
Yeah.
Yep. Real quick, can you explain what that is?
That's pretty cool.
Because I've never heard of that before.
The PCAT. So it's just like, if you're familiar with the MCAT, like you sit for an exam before you go into medical school, it's the same thing. It's just for pharmacy.
Oh, cool. Cool.
Yeah, because when
standardized tests, darn it.
Oh,
well.
so.
All right. Should I move on to the next question now? If that's all right with you?
That totally works.
Okay. I'm just curious, like, did I cut off again? Because I just hear silence. Okay. The next question. Next question kind of also goes off of the previous one, but this one is kind of more specific about the classes. So did you take any specific classes in high school or undergrad to prepare you for your career? I know you said chemistry was a big one, so do you want to elaborate on that?
Yeah, you need to be a chemistry buff for sure to want to go into pharmacy. You take all the chemistries and organic for sure. And then like micro and all the math classes, calculus, all the things. So it's very math, science directed sort of classes. I think I even took genetics, but
that sounds pretty cool. So
I love genetics. I've sometimes I'm like, man, I should have gone into genetics. I don't know what you would do with that.
No, it's kind of scary.
I think genetics are so interesting.
Yeah, well, I'm actually in AP Bio right now, and we're doing genetics. It's a lot more complicated than I ever thought. I thought it was just going to be like Punnett squares and stuff, but nope, there's a whole other layer.
Yeah, for sure. That's fun.
But yeah, continuing on with the questions about education. So with a lot of healthcare careers, you kind of have to do continuing education to maintain your license. So does that also apply to pharmacy?
Oh, yes, absolutely. You have to do a certain amount of hours, and they have to be accredited, and these hours also have to be more than accredited. They have to be like specific to like specific types, and so you just have to look that up on your license, on your licensure websites. And we do renew license every 2 years, so you have to, it's important to keep up with your continuing education. You don't want to leave it for the last month. Get them all in.
So the way your continuing education works, is it like actual classes, or do you have like online modules?
Yep, it's a combination of both. So you can go to like live lectures as long as they're accredited, and then also definitely online modules. There's companies and websites and pharmacy, news press things that you can sign up for and just complete those education, and then they'll submit it through to the NABP, who keeps track of all your hours.
Yeah. And I mean, the next question I was going to ask you is, how often do you have to renew your license? And you said it's every 2 years, I believe, right?
Yep, that's right. And they do, background check and all that jazz.
Yeah. Kind of like the, I guess, standard paperwork or whatnot. But anyways,
Yeah.
That's pretty cool. And so this one is kind of interesting, and I just like to ask people this question. And it is a make you think question, but you probably already thought about it because you had the questions. So if you could go back and do one thing differently, what would it be?
Oh man. As well, see, I don't know. Like like I said, I do love genetics, so maybe it would have gone in there. Another thing that I've thought about is, man, I should have gone back and been a trauma surgeon. I kind of feel like that would be cool. And the other thing too is I never really explored, because I really got into pharmacy straight from high school, so I didn't explore too many other career paths. And sometimes, working in healthcare can be pretty tough and pretty grueling. And as far as mentally, sometimes I think, man, I should go into, like to be an engineer or something like that, where it's a little like, because you make life or death decisions every day at work, and I feel like sometimes that weighs heavy on the heart a little bit. So sometimes I'm thinking, man, I should have really gone into engineering because I loved calculus too. So, but I do love my career. It's definitely something I've thought about before, though.
Yeah, and I know you said, as a healthcare professional, you always have to make life or death decisions for people. And with that, there is a heavy burden. So just kind of out of curiosity, how do you cope with that burden?
Um, that's a good question for sure. I think that it's important to always talk to people about it and how you're feeling, and because it's not really good to hold back your emotions. I won't lie, sometimes I do cry in my car. I don't want to scare you guys, but like sometimes it can be a little overwhelming, so I think it's important to let your feelings out and don't bottle it up inside, because it'll do more damage if you're not letting yourself feel true emotions, because it's really easy to do, as a professional in the workplace. I can really flip a switch and become, everything becomes routine, because it's something that I do every day and like that I excel at is, certain tasks. But then at the end of the day, you kind of flip that switch and, you get back to like reality, like, okay, this was something that I need to talk to someone about. And, it's okay to feel emotions for sure afterwards, but it's something that, like, a lot of us in the healthcare field will kind of flip that switch. We flip into like a different mode to where it's, it's work, like this is what I'm doing, and I actually will be better for the patient, if I kind of disassociate myself from like the actual situation, if that makes sense. And then allowing myself to feel feelings afterwards.
Yeah, I'm really glad that you mentioned all of that. Sometimes it is hard to speak up about it and talk to people about it, but sometimes it just becomes a necessity, especially in healthcare, because if you're not well, then you can't treat somebody who's also not well. So, it
Yeah,
kind of doesn't work like that.
for sure. And you get used to it, but it's like I said, it's a different kind of mode that you're in when you're actually there working sort of situation.
Mhm. Yeah. And honestly, about the crying, you're fine. Because I know, like, and I feel like everybody going into healthcare should know this, is that it's not all like bright and happy. Obviously, death is a reality. Sometimes you just have to face it. And it's kind of unfortunate, but that's just how it is. So it's kind of a mix of both. And I feel like that's what makes it like a roller coaster. And that's what pulls me towards this field. I just think it's so emotional and attractive to me.
Yeah, for sure. And you try your best, and like all like the only thing that I want is the perfect outcome for every patient. So I put my heart and soul into what I do.
Yeah. And in the end, it's important that you knew that you tried your best. So
For
yeah,
sure.
focus on what you can do and let go of everything else that's not in your control. I like that mindset. Um, and yeah, so this is the last question I'll ask you before I pass the mic back to Gibby, and that is, what are some soft skills that you believe are vital to this career?
Okay, so some soft skills. Like I said earlier, a lot of pharmacists are type A personality. So we kind of jive with the whole attention to detail. That in the multitasking, it's kind of like a type A personality fits really well with pharmacists, I've noticed. Another thing that I would say is communication skills are extremely, extremely important in pharmacy because we interact with all the departments. We're talking to the doctors, we're talking to the nurses, we're talking to lab. So I think it's really important that you have these, communication skills, and you're able, to be personable, because you have to communicate with and work with a bunch of different people, and pharmacy definitely is in the middle of all that. So I think you need to be personable. You need to be able to speak with other people and be respectful and cognizant of the other professions, and yeah, attention to detail. And I don't know. I think that's good. I don't know.
No,
That's
that's
all I got.
perfect. I think all of those things are very important in pharmacy. Attention to detail, like Gibby said earlier, you can't mess up the dosage because that could kill the patient. You don't want that. So,
Yeah, I try to tell people. I like
yeah.
to tell my students that I equate pharmacists to like the police officers of the healthcare field, because we're involved in making sure that everything goes right. We want to stop anything before anything bad happens. So it's kind of our job to be policing things. Like, if I catch an order that's maybe wasn't meant for the right patient in there, I'm able to go talk to the doctor. Oh, whoops, sorry, I put in the wrong order for the wrong patient, and I'll get that switched, that sort of thing. So we're kind of like the police officers of the healthcare field, keeping it all in line.
And that is very, very important. Somebody needs to check to make sure everything is going fine. So yeah, thank you for sharing all of that with me and all of us technically. So I will pass the mic back to Gibby now.
All right, thank you. Yeah, it's definitely important that you have those skills. I think communication, especially. I'm also in a college speech class right now, so that's really where we're hitting the bat right now is communication. I think without it, really, you wouldn't be able to do really any career without it, because you have to communicate with at least somebody, and to constantly be talking with patients, with doctors, with other pharmacists, with everything. You have to always be, on point with your communication. So I think that's something that's very important. So my next question is, so the last question was about soft skills. This is, what are some hard skills that you believe are vital to this career?
Yeah, so I'm not gonna lie, you guys. I had to Google hard versus soft skills. I was like, why do I have actually no idea what a hard skill is? So I think based on the definition of hard skills that I found, I think that for pharmacy, you have to, your mindset would be like chemistry and math. You need to be able to have the ability for route memorization, because there are lots and lots and lots of drugs, and I know you're not expected to memorize everything because we're always able to look things up, but memorization is a huge part of my job. Critical thinking skills are completely necessary, and also adaptability, because you never know what situation you're going to be in. But yeah, I think those fall in line with what hard skill definition is.
Yeah, most definitely. I'm going to be completely honest with you. I also had to Google it. I did not know the difference either. I didn't even know that there was hard and soft. I just, kind of figured you had skills and that was it. But yeah, those are definitely some good things to have. So moving on, my next question is about opportunities, things that people might be able to experience coming into this career and things. So the question is, wrong question. I was looking at the wrong one. Here we go. What opportunities exist for advancement in this profession? Where can you go after you first started? Where can you go after that? And, things like that.
For sure. I kind of touched on it a little bit, that there are specialties that you can go into. So emergency department, emergency medicine is considered one of the specialties in pharmacy. So not every pharmacist wants to be in the emergency department. It's definitely a specialty. So like I said, this different specialties, and also within pharmacy, you can, there are managerial roles that you can pursue as well, if that's something that you would consider doing. As far as advancement wise, so specializing, so like I said, I'm going to try to specialize with my BCPS in the emergency department, and then also managerial roles. Pharmacy is also something that you can move a lot laterally too. So if you didn't like being in the hospital, maybe you could also move into a retail world. It's the same license. So if you didn't want to work in the hospital anymore, you could definitely move to Rogers Pharmacy or something like that. It's the same license. There's a lot of lateral movement too within pharmacy, and you can also do infusion pharmacy, where you check specialty drugs and things to that nature. So there's a lot of different opportunities within the world of pharmacy that all fall under the umbrella of the same licensure.
Yeah. Well, that's cool that there's so many different opportunities, because if one person wants to go into one career, but then another person's like, well, I don't really feel that, they have other options. And I think that's really cool, because not everybody has the same vibe with the same career option. So I think that's awesome that there's some variety there. Yeah. So my next question is, do you have any advice for students seeking a career in healthcare, and maybe think if you could give your younger self advice, what would it be, so that that's kind of something that we could think about, or just general advice that you would have for them? What would that be?
I didn't think this one out. But I think it's important that in healthcare we all recognize that every decision that we make throughout the day directly impacts another person, and so it's important to be extremely professional no matter what profession you're in within the healthcare field, because you are affecting other people. You make an impact on their lives. Everyone, at any profession within the entire hospital, so from the pharmacy technician to the pharmacist to the nurse to the technician, or into the housekeeping, you're making interactions with people every day, and sometimes it's not their best day. So it's really important to put your best foot forward and recognize that you're having a direct impact on people's lives every day. So it's a decision that you shouldn't make lightly when deciding what you want to do with your career.
Yeah, and that's part of why communication is so vital, because it really doesn't matter where you're going to go, you're interacting with somebody, so you have to be able to do that. I think that is some great advice. Thank you for that. So my oh nope, I have 2 questions left. My bad. My next one is, when did you know that you were going to pursue the career that you have? And I know you talked a little bit about job shadowing after your calculus teacher suggested, then going right into farm. So, you know, if it's nothing past that, then that's fine, because I feel like you've covered that pretty well. But is there anything else you'd like to add to that?
Nope, that's it. That's all I did is I just job shadowed, and I actually job shadowed different pharmacists too. Like I job shadowed a pharmacist at a retail setting as well. So like I went to a Kmart. I know those don't exist now. You young kids probably don't even know what Kmart is. It's like a Walmart, or was, and they had a pharmacy. So I shadowed some retail pharmacists as well as the clinical pharmacists, and they're, like I said, they're apples to oranges. So I knew that I wanted to when I went to I was going to do a residency in pursue clinical pharmacy.
Yeah, well, that's cool that you were able to shadow with both kinds. Again, I didn't know that there were, before even starting this, I didn't know that there were other pharmacists other than the ones that you would see in a pharmacist at a convenience store. I really didn't know that. So I think it's really cool that you were able to shadow with more than one. That way you could kind of get a perspective of what each one is like and how they're different. That's really cool. So my last question is kind of like the one that I asked you just before this one. But it is, what's the best piece of advice for someone interested in this particular career? So the last one's about for somebody just interested in healthcare. But do you have some advice for somebody that's specifically interested in this career?
This is just more so advice for anyone. I think in any career, I think that positive, and I always tell this to all my residents, positive attitude is so contagious, and you can change any situation and get a positive out of a situation. You can have any opportunity, like any situation is a good learning opportunity, right? So even if, you know, something's going wrong, as long as you have the right attitude and the right mindset, you're going to get something out of it. But anyway, do you guys mind if I wrap it up soon though? I'm so sorry. It's 6:00 and I kind of have to go.
No, you're okay. That was my last question. Thank you for being here and letting us interview you, for answering our questions and everything. We really appreciate it.
Yeah.
Taking your time out of the day and coming here to talk to us. Was there anything else that any of you wanted to add, or that you or I wanted to add, or Taylor, anything before I give the mic back to Taylor?
No? All right. Thank you so much for joining us. We really appreciate it. I'll let you go. I know you're in a hurry and we kept you a little extra long. So, but thank you for being, thank you for joining us and rescheduling with us, and being so positive and answering questions so honestly. We really respect that, especially when they're deciding kind of what they want to go into. So being so honest and positive is exactly what we want. So thank you for doing that for us. We appreciate it. And if we have any so, all right. Well, we'll talk to you all next time. If you have any questions, students, feel free to reach out to me. Go ahead and email me with anything. If not, then we'll see you next time on our virtual career chat.
All right, thank you guys.
Bye. Thank you. Have a good one.